We've certainly heard of more potential suicide attempts last night. I think that the community is probably in a much better position to talk about what's happening on the ground than me. My role here in Parliament is to talk about what are we doing in terms of the overall structural responses that need to be. So we're moving beyond the band-aids and waiting for these cycles of emergency to develop, and then we send in an emergency team and then everyone leaves. This is a structural issue of hopelessness affecting children across Canada. That's why I've called for this emergency debate, and I'm hoping we can start to look at some of these larger issues in the terms of failure delivery of services in the federal government. We have to do triage, so we have to get the healthcare workers, we have to deal with the overworked police and frontline workers. Okay, so we have to do that there. But then what about all the other communities? In this new budget, there's $0 for Indigenous healthcare and $0 for Indigenous mental health care. So obviously, we're not going to be serious about fixing this unless we put those dollars in to ensure that the delivery of services there. But I think there's a bigger issue in terms of who we are as a nation and this time in our history. This may be a moment when we say, let's start to really actively engage the young people. Let's bring them forward in the regional and national discussion groups where they can be tasked with coming to Ottawa and telling us what they need in terms of delivery of services, because I think what's obvious is that we have had policies run from the bureaucracies of Indian Affairs or Health Canada, whether they've been well-meaning or just passing the buck policies, that don't deliver on the needs of young people in these communities, and we have to do better.